Welcome everyone to yet another extremely powerful session of Speaker X, a series that we started, and it is actually helping so many of not just our participants, but those of you who listen to it, as a YouTube video. Those of you, and like I keep on getting so many messages, so many emails, that the powerful sharing that our Speaker X keep on sharing in these sessions, and and my what you can call it as comments, my briefing about every single point that they share is so helpful to grow the practices. In fact, the other day I received a message that someone's practice has gone up 3 times just after watching or listening to the Speaker X. Okay. And today we have a very dynamic, very active, uh, a very systematic, sincere dentist, and a very good human being. Okay, as our Speaker X, Dr. Vishwajit Darvi from Nasik. So, Dr. Vishwajit, welcome as a Speaker X, and your first thoughts. Good morning.
Uh, Good morning, sir, and all of you. Sir, my first thought is gratitude. Whatever I'm today in every aspect of life, it's all because of you. So, gratitude, and gratitude from the bottom of my heart, sir, for you. Over to you, sir.
Okay, wonderful. Thank you so much. And so, as I said, that someone who Dr. Vishwajit is someone who practice everything, and we talk about the concept of being grateful. Okay, in the first session of Life Excel itself, Personal Excel, and that's where he started. So, thank you so much, and I'm so happy to be the catalyst in your growth, in the growth of so many of us, um, of our community participants. And just introduce yourself formally, because those who probably are watching on YouTube may not know you. So please just introduce formally to yours.
Yes, sir. Sir, my name is Dr. Vishwajit Darvi, and I'm practicing dentist in Nasik, which is tier 2 city in Maharashtra. Though I am a general dental practitioner, I consider myself as a surgeon from heart. So I have a special attention in dental implantology. And with your guidance and teaching, sir, my 60 to 70% practice revolves around implants and aligners presently.
Wow, this is super powerful. In fact, imagine. So now, guys, those of you, who are just BDS graduate dentists, and you think that, it is must to do the post graduation and all those things. Look at it. A dentist, a BDS graduate, whose practice revolves and evolves 70% around implants and aligners. A very smart guy, isn't it? So, isn't it? So imagine it's like 70% of your practice is somewhere around high value treatments. Okay. So how it started? So you practice in Nasik. Since how many years you are practicing? Like when did you start practicing? What kind of challenges you used to face in the initial years, or what sort of practice you had in the city of Nasik in the initial years of before you came across me, you came across this community, you came across our courses and curriculum. Yeah.
Yes, sir. So basically, just one small correction. I have done my master's in maxillofacial radiology in 2014. After that, doing a 1 year of locum in 2015, I started my practice in Nasik. Uh, I will say, sir, from 2015 to 2022, in these 7 years of practice before joining the community, my practice was basically led by my mindset. And I will say there were so many limiting beliefs which I was having in my mind, because of which I was not able to take my practice beyond 6 digit. This was the condition. So I will share some of my limiting beliefs on which I have worked in this last 3 years via MDF and online life Excel teachings. The first belief was dentistry is not a business. Then, even if we consider dentistry as a business, I am a Marathi guy, so Marathi people don't know how to do a business. Then I have read one thing. कि 85% of billionaire and millionaire in the world are first generation billionaire and millionaire. एंड आई वाज लाइक कि भाई मेरा तो फैमिली ऑलरेडी हायर मिडिल क्लास में है, तो मैं मेरे लाइफ में कभी मेरे प्रैक्टिस को बिलियनर और मिलियनर में लेके जाऊंगा या नहीं लेके जाऊंगा. सो दिस वाज माय थॉट. देन द नेक्स्ट वाज लाइक, मैं हमेशा मेरे पापा से सुनता था कि डॉक्टर लोग बहुत लूटते हैं पेशेंट्स को. तो आई वाज लाइक आई एम नॉट गोइंग टू टेक दैट लुटारू टैग ऑन माय दिस. Then in that 7 years, sir, I used to do 30 to 40 patient and I used to earn a lakh rupees income. तो मुझे लगता था कि प्रैक्टिस 4 times करने के लिए, 5 times करने के लिए, I want like 40 into 4, like 160 patients in my practice to take my practice to that level. Then one more belief was I have done my master's in maxillofacial radiology. तो मुझे लगता था कि how people will accept me as an implant specialist after doing a specialization in non-clinical branch. And one more limiting belief was sir, कि I was like कि if I will start doing general practice after doing specialization, the people and the colleagues around me will laugh at me. They will say इसने वो 3 साल में किया ही क्या, ये वापस जनरल प्रैक्टिस इसने शुरू कर दिया. So these were some of very important limiting belief which I was having. And my father always used to say, कि, hey, you don't know how to do a record keeping. Every time. You don't know how to keep the money, track on the money. ऐसे. But this was the situation, sir. And because of that, I was not able to take my practice to 6-digit figure. I was hardly crossing the 6-digit figure in the first 7 years of practice. Over to you, sir.
Okay, so guys, this is super powerful, isn't it? In fact, very, very interesting, way to start this. Because I'll tell you something. Very rarely people understand so well, okay, their own limiting beliefs. We talk about limiting beliefs in personal Excel, okay, life Excel. And, Dr. Vishwajit actually narrated them so well. So, like the first couple of them, that, dentistry is not a business and Marathi people don't know how to do the business. Okay, very interesting. Yeah, because now let me tell you, now when you say like dentistry is not a business or something, those of you who have actually read my book, I have said this in the first chapter itself. Always remember, when you are treating the patient, okay, you should always treat from your heart. There is no business when it comes to treating the patients. Okay. If you think instead of using this quality, you need to use this quality material so that you can deliver the best treatment to the patient. Even if you have already mentioned the charges and now upgrading your materials, upgrading your equipment, upgrading your technology to do that particular treatment is going to charge you extra, my very frank advice, paid from your pocket. Literally, paid from your pocket. What will happen? You're not going to lose anything. You're not going to suffer the losses. The profit will be less. That's it. I hope you got that. Okay, the profit will be less. It will be loss in the profit, but there will be no net loss. When you're treating the patient, you should always treat the patient with your heart. Always remember this. But when you're managing the practice, management is the function of your brain. Remember. So it's not that you don't manage with your heart. You definitely add your own flavor in managing the practice. So when I say practice management, what does it mean? It means managing yourself in your workplace, managing your team in your workplace, managing your practice as a workplace, your appointments, your payments, your inventories, managing your material people, your lab people, the workflow. Okay. So when it comes to managing the practice, you should manage it from your head. When it comes to managing, doing the treatment, you should do it from your heart. Okay. Okay. Always remember this. The biggest mistake that people make is they try to put their head when they are treating the patient. I'm going to make only this much money if I reduce these charges, if I reduce this material, or if I upgrade to this, whatever. मेरा खर्चा बढ़ जाएगा, प्रॉफिट कम होगा. They put their head when they treat the patient. And then they'll end up doing substandard treatment or below average treatment or average treatment, whatever you call it. Okay? And that is where their materials also start shifting from west to east, because they want to either maintain the profit margin or they want to increase the profit margin. Both are incorrect. There's a very powerful quote by Zig Ziglar who says, take care of your customers, they will take care of your profits. Similarly, for us, it's take care of your patients, they will take care of your practice. It's very simple. Okay? So managing your practice is a business. You're the CEO of your practice when you're managing the practice. Okay? Doing the patient, you're a professional. So treat like professionals, manage like CEO should be the mantra. Coming to Marathi people not able to do it. Honestly speaking, it's not like that. Yes, agreed that majority of, Marathi people are not exposed to businesses. Okay. They are either, into jobs, or majority of them are professionals. Because, the culture of Maharashtra is such that we like to learn a lot, keep on learning, keep on learning, keep on upgrading, keep on doing something new. So you always have that, that learning mindset and implementation mindset. But when it comes to business or managing the business, you need many, many aspects apart from just the knowledge. Okay. So we, by and large, are not as much exposed to business thing as, otherwise. Guys, just give me a couple of seconds. That's it. Okay. So it's not that you can't do it. All you need to do it's do it in a very systematic way. Forget about the business management part, but practice management is not that difficult. Okay. Because if we compare our practice with a business, we are either, kind of solopreneur or micropreneur. Okay. So we have a team size of 3, 4, 5, 10 people. That's it. So in the context of business, it's actually not even a micro business. Okay. So micro business at least have like 20, 30 people. So don't think that it's okay, not very, trust me, it's not very difficult to manage the practice. Okay. Then doctors both loote simply because people, we talk about price versus value all the time. When people see the visible value in your practice, the price will not appear high. The perception of price will be reasonably okay. Okay. So your entire focus should be on value addition than anything else. Then you have to do 30, 40 patients to make ₹1,00,000. Big, big myth. You just need 3 implants to make ₹1,00,000. Very simple. So your revenue, honestly speaking, has nothing to do with the number of patients you do. Those of you who just want more and more and more patients in the practice, just break this myth. I'm repeating this again. Your revenue has nothing to do with your practice. I know practices in India who do less than 100 appointments a month and their revenue is in 8 digits. You heard that right. Okay. They do less than 100 appointments a month. Their revenue is 8 digit. So the revenue of your practice, trust me, has nothing to do with how many appointments you do. And it's not about quality versus quantity. It's about practicing 3M and then adding the flavor of upselling and upgradation to it. Simple. Those of you who are gold and diamond members will be able to relate to this even more powerful. Okay. Limiting belief. People from service and job salary background has difficulty in managing the business. Yes, it's difficult for them, but not impossible, right? Everything was difficult. Giving that block on day one was also difficult for all of us, right? And then finally, as Vishwaji said, that I'm a radiologist. How will people accept me as a general dentist? Or people will laugh at me. Don't worry. People laugh at everything. Okay? दुनिया का सबसे बड़ा रोग क्या कहेंगे लोग. So never be worried about that. Okay, cool. So, and Vishwaji thought that if I want to make 4, 5, 10 lakh rupee ka practice, I'll have to do like 100, 150, 200 patients a day. In fact, the more number of patients you have all of you, just think about those days when you are too busy, when you had too many appointments. You will be actually, if you observe, you will find that you are not able to give proper time to every new patient. You are not able to upsell properly. You are not able to answer their queries properly. How many of you agree? Type agree in the chat box.
I agree.
Okay, so if you have too many appointments, like too many new patients, in fact, it's other way around. So that's why when you do too many patients, your revenue on that day is this much. When you have less number of patients, your revenue is this much. If there is one very powerful message you have to take from today's Speaker X, take this. Number of new patients or number of appointments has nothing to do with your revenue. Believe it or not. Okay. So, Dr. Vishwajit, once again, going forward. So finally, you broke all the myths. Dentist knows how to do the business. Okay. A Marathi person knows how to do the business. You don't need 40 patients to make 5 lakh rupees. Okay.
Yes.
People do accept a radiologist, oral radiologist as a dentist. And even if people laugh, it just doesn't make any difference. Okay. And dentist does not loot. Okay. Fine. But then what sort of actually challenges you face in the first 6 years of your practice, 6, 7 years?
So because of my limiting belief, the first challenge was I was never used to give the multiple options for the treatment. My practice was almost 90% around RCT and metal crowns only. I used to do extraction, RCT, metal crowns, and dentures in my practice. And I used to hate ortho. So pata nahi, shayad I was not able to convince the patient for ortho also. So it was a very basic and general practice which I used to do. And then second thing, as implant was my passion, I used to do force selling to my patient. Like अगर कोई मिसिंग टीथ का अगर कोई पेशेंट आता है तो मैं उसको इम्प्लांट की तरफ जाता पुश करके लेके जाता था ना अल्टीमेटली ऐसा होता था कि मैं इम्प्लांट भी नहीं कर पाता था और मैं ब्रिज भी नहीं कर पाता था.
Okay, now this is very powerful. Huh? Again, two things which he shared, that the practice was basic. Again, and I'll tell you, this is a classic problem when your practice is new. And what's the classic problem? The classic problem is it becomes very difficult for you to upsell or to convince people for high value treatments, high ticket size treatments. When it comes to the basic dentistry, extractions, scaling, restorations, root canal, crown and bridge work, you do it very well. But the moment it comes to implants, aligners, flap surgeries, FMR, full mouth implant, whatever, lasers, you don't do that. You're not able to do that, because the mindset, will people pay 1 lakh rupees? Will people pay 3 lakh rupees? No. ये तो इतना ज्यादा है. मेरे को तो बोलने में ही डर लगता है. How many of you were like that before joining our community? Type me in the chat box. Okay. I still remember. Okay. That so many participants have told me कि सर मेरी तो जुबान कांपती थी 2 लाख रुपए बोलने में, 3 लाख रुपए बोलने में. The point is, the problem is because we have never been taught these things. हमें ये सिखाया ही नहीं गया है कि see, you're not selling 10,000 का treatment for 1 lakh rupees. You're selling a fair 3 lakh rupee का treatment for a 3 lakh rupee. But even if we are fair, it becomes very difficult to talk about for 3 lakh rupees simply because nobody has taught us how to talk about 3-5 lakh rupees. So normally when your practice is new, again, this is a limiting belief only. This is a mental block that people will not get ready for 50,000, 1 lakh, 2 lakh rupee treatment. That is where you need to work on that. And what was the second thing you said?
Like sir, my implant was my passion, so I used to do force selling.
Nice. Now implant is a passion, so you land up telling implant to every patient who needs a tooth replacement, and you land up neither doing implant nor a bridge. Okay. In fact, how many of you have seen this happening? Type yes in the chat box. Okay. Very, very, very common, isn't it? Now, this also happens When, say, for example, you have recently done an implant course, bought an implant kit or a physio dispenser, and when you come on Monday morning, you are so charged up and you want to do implant, you talk about implant to everybody, and people just run away from your practice. As I always say, force selling never works. Always remember this. Force selling never works. Okay? Because if you force sell, people will literally, push back. They will move away from you. So never do force selling. We have talked enough about this in so many sessions, right? Yeah. And Avni says, in a small town, if there are less patients, people think that dentist ka practice chalta nahi hai वगैरह. Again, it's a myth, Dr. Avnish. I have practiced for 18 and a half years in a small town. So this is your mental block, your limiting belief you need to work on. It's nothing like that. Okay. And with all honesty, it just doesn't matter what people think. Eventually, they know what is the truth. Okay. So, okay, nice. And Chetan says, I myself used to tell patients, this is costly, huh? Now, when you yourself say this is costly, how will patients do implants and FMR and all those things, isn't it? So cool. So nice. So this was how it was, and because majority of the practice was focused on, drilling, filling, billing kind of dentistry. Okay, so it becomes very difficult for you to make money. Okay, even if you want to make, say, 50,000, 1 lakh rupee ka practice, you still have to do lot of patients, lot of, like, so many number of patients, simply because the average ticket size is less. The average revenue per patient is less. So how and when things changed for you?
Yes, sir. So first of all, I would like to tell one funny thing. Before in 20, I have joined the community in 2022. In 2021, I have joined one implant course, one-on-one implant course, in a hope of that I will learn how to convert the high ticket cases for the implants. And I have paid 7 lakhs rupees for this course.
Oh my.
And I was like, and when I asked that mentor, he was very good as far as domain knowledge is concerned. But when I asked him, sir, how you convert the patients? So he was like, I don't do consultation. My wife do the consultation in the clinic. So, so yeah, that I was like, I was expecting wrong thing from the right person. And तो मैं चलो बोला चलो ठीक है fine. Then in 2022, I came across your Facebook ad. After coming across your Facebook ad, then I contacted Dr. Basalraj sir. He is my buddy also. तो बसवराज सर को मैंने फोन किया तो he told me that it's a very good course, you just jump in. So then from in 2022, from March to December, I enrolled in everything: silver level, gold level, diamond level, then wealth excel, and ultimately into the life excel. And I, uh, I observe one thing, sir, that people will hesitate to enroll immediately in the courses, like our courses. But important thing is that इट्स अ कंटिन्यूस जर्नी. इट्स नॉट लाइक कि आपने एक बार एमडीएफ का सब कुछ किया और एक बार लाइफ एक्सेल किया तो आपको सब कुछ आ गया. ऐसे नहीं होता कभी भी. सो इफ यू विल स्टार्ट टुडे, you will get the results in 2 3 5 years. So but I think people will not understand that, and people will more focus on the money part कि मुझे 2 लाख भरना है. So I was like, sir, 2021 में तो मेरा प्रैक्टिस 1 लाख का भी नहीं था. I invested 2 lakhs rupees in our courses. So we should take a bold decision and enroll in the courses immediately.
Oh,
Or
this is powerful. Now you again talked about another interesting psychological part of human brain. Okay, that a lot of people think that yeah, I have done silver course and that is more than enough, because उसमें तो कुछ नहीं, इतना ही है. It's not about itna hai, utna hai. It's a journey. As I keep on saying this about Alvin Toffler, okay, one of the very powerful quote that, the illiterates of the 21st century are not those who cannot read and write. He says the illiterates will be those who cannot learn, unlearn, and relearn again and again. Learning, upgradation is an ongoing process. It is not a one-time process. Okay, it's an ongoing process. And unless you keep on learning, you will never be able to get the real benefit of it. It's very, very simple. Then imagine someone whose practice was 1 lakh rupee. In 1 year, this guy is paying 2 lakh rupees to different courses. But then that is when you start creating that magic. Okay? Because as I always say, a lot of people say that I have done silver level this year, I'll do gold level next year, I'll do diamond. It's not like that. This is not how you learn. Always remember, you decide that I'm going to make my practice like, 5, 10 times growth all out. I'm going to full on into it. And I'm going to do whatever it takes to make it happen. Now, once you have that fire in your belly, once you have that mindset, all you have to do is to jump everywhere together. I always say this, when it comes to domain skill learning, clinical courses learning, you should always do it step by step. Simply, like for example, you learn implants, you start doing implants, you become better at implants, and then maybe you go to veneers or FMR or something like that, or laser. But when it comes to soft skills, the problem is you cannot do it one by one. Because when you're doing that patient consultation, the communication and presentation goes hand in hand. When you're in your clinic, the management, leadership, team building goes hand in hand. The objection handling, the price objection handling goes hand in hand. So soft skills is not something which should be learned one by one. All you have to do is to put yourself into the washing machine of learning. Give that 1 year, 1.5 years for yourself. Enroll yourself in all the courses. Get as much knowledge as you can. Implement as much as you can. And refine yourself. That follow-up mechanism is all about becoming better and better and better version of yourself. That's it. This is the best way of learning. When you do that, you start seeing miracles in 3 years. So, what kind of miracles you saw?
Sir, after joining the community, I have joined the community in 2022. In the first year, I have seen 30% growth. In the second year, I have seen 90% growth. And in the last year, I have seen 45% growth compared to the previous year. So presently, my practice is 3 times to what I was doing before joining the community.
Superb, right? 3 years, 3 times practice growth. What else you want? The best part is, this is just the beginning, isn't it? Because as you very rightly said, I'll tell you what, I meet so many pre-COVID Life Excel participants, and they are like, sir, the real benefit to we are getting now. Because it's an ongoing thing. Okay, in the beginning, you will get the benefits like knee-jerk reaction. It's like there are so many things which are new. You implement whatever you implement and you will still get results. You will still see the practice growth. But once that gets saturated, then the real implementation happens at the subconscious level. And imagine a practice, 7 years, pretty more or less stagnant. You have to do like 30, 40, 50 patients a day in order to do whatever you were doing. 3 years, 3x practice. You don't have to do that many patients. You move from hard work to smart work. You enjoy practice. You earn the reputation of being a good implant dentist in your city. What else you want? So what are the top few things that you implemented or that changed the game for you actually?
Yes, sir. So first, I will say that work on your limiting beliefs. Introspect your beliefs, whatever the beliefs you have since childhood till date, and start working on that. Start challenging it with right people, with right incidences, or with proper book reading. और आपको ये सब कुछ नहीं करना है तो best is enrolled in the personal Excel और सुजीत सर से guidance ले लो. So first is that. Then second, sir, I will say most of the time whenever we are doing a goal setting, we always set the goal for the future. So by default, what people will think कि currently I'm not happy with whatever I'm having, and I'm going to happy after achieving the goal. But this is not the case. In the goal setting, we should always have a satisfaction as one of your goal along with the success one.
Superb.
Then the third one is use your morning hours. That is, I call it as a power hours very effectively. In first 2 hours, you have a chance to work on your physical goal, mental goal, intellectual goal, and emotional goal. So if you set the momentum in that 90 minutes, the day is set for you for the entire 24 hours. And I will say कि Follow your body system. Dr. Basavaraj sir is always with me whenever I have some problem because I am a squiggle personality and he is a logical mindset. He's a rectangle one. So I always take an opinion from him that I should not take any impulsive decision. And he always helped me every time at night also, sir. Sometimes I've called him at 11:30, 12 o'clock in the night. But so follow your body system. And one more thing, which is very important, that you need just one patient in your practice to take your practice to 2 times, 3 times, 4 times, or 5 times. So, till the end of the month, till the last 1 hour of your last minute of your practice, don't lose your hopes. Because in some months, sir, I have completed my targets in the on the 30th or 31st at 8 p.m. or 9 p.m., sir. So don't lose hope. You need only one patient to take the practice to the next level.
This
These
is
are my
very,
words.
yeah, this is very, very powerful. Huh? By the way, those of you who think this month is okay, mhm, you never know. You need only that one or two patients to do everything. It's so powerful. Okay. Yeah. Last ball pe hope rakho nahi. It's not just about hope. Be prepared. You get that full toss and you can always hit it for a six. And that again proves to be a no ball and you get another free hit. Okay. So this happens so many times. I'll tell you this. Even I've seen this happening so many times, right? And as he said, keep on working on your limiting beliefs. I'll tell you what, your best friend and your worst enemy is what you see in the mirror. Always remember this. Okay. Your best friend and the worst enemy is who you see in the mirror. You can break yourself and you can make yourself. Nobody else can. Okay. Always remember that. Follow everything, whatever you learn. A very, very profound thing that you share is, happiness must be one of the goal along with success. And those of you who have done personal excel, those of you, I keep on talking about this so much. Happiness and success are two different things. Successful people may or may not be happy people. But guess what? Happy people will always be successful. Okay. Yes. So before we conclude, very powerful. Your last thoughts, your lessons, your words of wisdom or motivation to everybody who is here.
So I love your one sentence every time. I will end this. I would like to conclude the session with that only. कि whenever you are taking the right action in the right direction, you will be literally unstoppable, and we are your unstoppable warrior in the upcoming years. This was the same sentence which I have repeated when I won the Dentalton Award, sir, and this is the same sentence. So you are always with us, sir, every time. So we are not worried about anything now. Thank you so much.
Okay, wonderful, wonderful. So, guys, just keep on taking the right action steps at the right time with the right intent, right motive, right passion, and you will become unstoppable. Okay. So, let me tell you, I always say this, you genuinely do not need lot of things beyond our community, beyond our teachings to achieve whatever kind of practice you want to achieve. Okay. And as I always say, this is just the beginning. Keep on doing it. Keep connected with this powerful community. If you are someone who is not part of this, please be here. If you are someone who is already part of it, I want you to at least bring one of your friends who is not part of this community. Make them part of this community. You will do a big, big favor in their life. I'll tell you this. Okay. So wonderful. This is Dr. Sujit Pardeshi signing off from this Speaker X. And thank you so much, Dr. Vishwajit, for being here, enlightening people, motivating people to go to the next level. And congratulations to your success. Keep growing. And very soon, I want to see you in the Millionaire Dentist Club. Okay. So all the best to you. And thank you, everyone. I'll see you in the next Speaker X session.